Well, everyone is looking to get back on track vaccinating people against COVID-19 after a week of setbacks due to snowstorms and delivery issues.
Now, it comes as 500,000 Americans have now died from the disease, and the South African variant of COVID was found on Long Island, raising fears this highly contagious variant could spread. All this makes getting the vaccine out even more urgent. Joining us this morning, the former acting director of the Centers for Disease Control and president of the Robert Wood Johnson Foundation, Dr. Richared Besser. Nice to have you back on Good Day New York.
Thanks for having me.
All right, so let's talk about the vaccine rollout. Was on pause last week because of the weather. They couldn't get the vaccines in here, and then we find out that Jones Beach had some kind of problem with storing the vaccine. How did that happen?
Well, you know, there are hurdles being seen around the country as these vaccines are rolled out. You know, some of it has to do with some of the challenging storage requirements that some of them have. One of the things that concerns me the most, though, is there's been so much focus on speed and the number of people getting vaccinated that there hasn't been enough focus on whose arms are the vaccines going into. And, you know, as you know, in New York, it's a very similar picture to what we're seeing across the country, where white residents are being vaccinated at a much higher rate than Black and Latino residents, even though the populations that have been hit the hardest in terms of cases, hospitalizations, and deaths have tended to be Black, Latino, and Native Americans.
You know, interesting that you say that. Of course, the city, our city and state are trying to do a lot to kind of keep everybody equal, and there's some new places opening up in Brooklyn today as we speak. But you know, when you look at the statistics, like just for example, if you take the sports stars, the NBA, the NFL, you know, some of these young men were offered the vaccine and they don't want it.
Well, you know, there's a lot that's being said about vaccine hesitancy, but I worry it's being oversaid, because when you look at the surveys, the majority of Black, white, Latino, Native American people want to get the vaccine right now. The rates of hesitancy are different, but the majority of people still want to get the vaccine. And what we're also finding is that when people are hearing from trusted voices and their concerns are listened to and respected, people change their minds as people know friends and family members who've been vaccinated. So I don't want to put too much weight and let our public officials off the hook too much on that account. If vaccines are offered, we will see people in all communities lining up to get them.
Dr. Besser, I get the feeling that pharmacies are really key to getting the distribution to people, particularly in local areas. But I know several pharmacies who are dealing directly with the FDA who say they're getting the runaround. So talk to us about the role that pharmacies should be playing.
Yeah, you know, that is something that is being ramped up, and the federal government is looking at distributing vaccines through corner pharmacies, places where people are used to getting their annual flu shot. There's efforts being done to do vaccination clinics in churches and community centers, places where people have levels of trust. That will all help. But one of the big challenges we have is that the distribution system is very complex. Each state is doing this differently. The registration systems are very different. In many places, if you don't have the ability to go online and don't have broadband, plus several hours to do your registration and call around, it can be very challenging. So simplifying those systems will be very important to ensure that everyone has access to vaccines.
I mean, you bring that up because we had a story earlier in Connecticut where they're opening it up to 55 and older, and then at some point down the road 16 and older, but it differs from state to state. There should be some consistency. Do you think that even leads to the problem?
Well, you know, the initial recommendations, there's an advisory committee that recommends to CDC who should be vaccinated. And as a general pediatrician, I always turn to that committee for advice in terms of what I should do. They recommended that after healthcare workers and long-term care residents, essential workers should be in that next group, and most states haven't been doing that. And so when you think about essential workers, that is police and fire. It's also the people working in the grocery store and driving the bus. It's the teachers and staff who work in our schools. Those individuals should be reached with vaccine ahead of individuals who are at lower risk. And it can be be harder to distribute vaccines to people who are working during the day. As you're saying, using local pharmacies, setting up 24/7 vaccination sites, those things will help in a big way.
Doctor, we had on Dr. McCary from Johns Hopkins University, and he painted a rosier picture than most doctors are out there about herd immunity and getting back to normal. We're going to play a little of his interview.
What's happening is that herd immunity has started to kick in. Now, herd immunity is not binary. It's not all or nothing. And what's happening is you've got 40 to 55% of the population now with some immunity. Maybe they had no idea they had coronavirus. Maybe they just have the activated T cells that give immunity and not the antibodies, which is what we've based our estimates on. And now we've added 17% of the U.S. population of adults has been immunized, and we're adding about 1.8 million per day. That was the number from yesterday. We could see really low levels by April or May of this year.
Dr. Besser, please tell me you agree.
Well, you know, what I can say is that I'm cautiously optimistic. I'm not as optimistic as that doctor. I think we need to be really careful here. I don't think we have a full understanding as to why the number of cases and hospitalizations and deaths has been dropping as rapidly as it has. I think some of it has to do with the number of people who have already been infected. Some of it has to do, especially in nursing homes, with the number of people who've been vaccinated. But I don't want people to let up. It's so critically important right now that we keep at it. Even though we're exhausted, we're sick of this. Wear our masks, wash our hands, let's keep apart, let's avoid crowded places until we truly know it's safe to change our behavior. Because if we don't do that, I worry that some of the variants that have been identified in different parts of the world could take hold. We don't know yet whether people who've been infected with the strain that's primarily circulated in the United States will have full protection to all of the variants or new strains that are cropping up. So we need to be very careful here. But this summer will be a lot nicer than last summer. That I can tell you, and I'm really looking forward to it.
All right, so somewhere in between there. All right.
That's right.
All right, former Acting CDC Director and President of the Robert Wood Johnson Foundation, Dr. Richared Besser. Great to have you on Good Day again. Thank you.